After weeks of tracking overseas developments, provincial officials confirm a mysterious new virus has reached BC. Provincial Health Officer Dr. Bonnie Henry says the province is well prepared and assures the risk to the general public is low. The BC Centre for Disease Control is working around the clock to test dozens of people. More than 100 have been tested in total, with only one positive result. The respiratory disease caused by the virus gets its official name from the World Health Organization, COVID-19, an acronym for the coronavirus disease of 2019, the year the virus was first identified. The province marks a grim milestone when a BC man becomes the first person in Canada to die from the virus. The Lynn Valley Care Centre in North Vancouver, where the man resided, would later become ravaged by an outbreak of the disease. Long-term care homes across Canada eventually turn into the tragic flagships of COVID-19 deaths countrywide. The WHO announces the spread of the novel coronavirus is now officially a global pandemic. It urges countries to wage an all-out war on the virus. The pandemic dominates the news cycle. The province embarks on near-daily news conferences. 3 p.m. soon synonymous with Dr. Bonnie Henry briefings. She repeats her key advice over and over. Wash your hands, physically distance, watch for symptoms, and stay home if you're sick. Dr. Henry would later say the day the world changed was March 12th, the day professional sports stopped in their tracks, events canceled, and large gatherings of more than 250 people banned. The pandemic, for many British Columbians, now begins to feel uncomfortably real. The limit on gatherings shrinks to 50. Any business, public space, or event that can't follow the rule is shut down. More than 30,000 non-emergency surgeries are canceled to clear out hospitals in case of an influx in COVID patients. And now a new phrase is heard, one that would turn into a goal the world over: flatten the curve. Every school across the province is closed indefinitely, further upending the lives of 500,000 school children and their families. A mass exodus from offices, too. Many people hunkering down to work from home instead, others losing their jobs entirely as the economy takes a nosedive. BC officials formally declare a province-wide state of emergency, giving the government sweeping powers to enact urgent measures in response to the pandemic. Canada and the United States announce an agreement to close their shared border to non-essential travel, a first since Confederation. A BC-wide ban blankets all dine-in options at restaurants, bars, pubs, lounges, and breweries, a foreshadowing of financial disaster for the hospitality and tourism industries. BC confirms its 1,000th case of COVID-19. Officials say there is zero chance that physical distancing orders will be lifted before May. Now, a turning point. The overall case counts and hospitalizations solidify into a downward trend as people slowly adjust to the new normal. Officials hint at a plan to relax the rules. BC becomes a beacon of success in Canada and right around the world for effectively slowing the spread of COVID-19 without ever having fully locked down. Officials give the go-ahead to expand personal bubbles to up to 6 people. Schools will soon reopen on a partial voluntary basis, and elective surgeries will start up again. BC's restart plan is cleared to begin after more than 2 months of restrictions. Businesses, restaurants, and society as a whole begin to reopen, but under stringent guidelines. Classrooms open their doors on a part-time basis for the final 3 weeks of the school year, but for many students, the pandemic will put a stop to their graduation ceremonies. Seniors in nursing homes across BC are finally able to see family again as non-essential visits are partially reinstated. For most, it's the first time they've been reunited in more than 3 months. BC rolls into phase 3 of its reopening plan, and careful travel is now allowed within the province. Health officials warn that complacency with the basics like physical distancing and hand washing could suddenly undo the progress that's been made.